viewers, welcome to a new episode on MEPOD. Hope you are all doing well. Today we're bringing an interesting topic on breast cancer. I'm Miss Grace Osayebo, and beside me I have Mrs. Dokas Akabwa Bentum, who is a physician assistant, and Master Emmanuel Boadi, who is a nursing officer. Today these are my guests who are coming to join us in the discussion on the nice topic before us today. You know that this month is Breast Cancer Awareness, that the month of October, and we are coming to have this perfect discussion today. Hope you're all doing well. And also kindly subscribe to our channel if you've not done so, or kindly follow us on all our social media platforms. Thank you very much. Ms. Dokas, please can you help us with any idea on breast cancer or cancer itself?
Thank you very much, and greetings to your viewers. This when we say cancer cells, we look at it as any abnormal growth in the body.
Okay.
So whenever you see a growth on the body, sometimes you call it tumor.
Okay.
And the nature of the tumor makes it cancerous or not. So whether you say it's on your body or maybe a scan picks it up, it is a tumor.
Okay.
But the nature of it will let us know whether it is cancerous or not. So when we say cancer are abnormal cells which are growing uncontrollably and then spreading in the body system. So that's what we mean by cancer cells. So when all this abnormal growth is found in the breast tissues, then we say you have cancer in the breast. Thank you very much.
You're welcome. That's very nice. So does it mean that could it be natural? Like does it occur on its own, or
for the occurrence, the cause of cancer cells or the growth of cancer cells are unknown. But on whatever you eat, the air that we breathe in, the food that we eat, smoking and all those kind of stuff predisposes us to have that abnormal cells. So it's not something that occur naturally, but it's your behavior, your attitude to health that cause for it.
Thank you. Master Emmanuel, please can you add something to the factors that she was mentioning?
Yes, of course. So first of all, we have hereditary or family history. If it happens that in your family bloodline, somebody had suffered cancer before, it gives you the chance to also develop one. We are not saying everybody will do so, but it just increases the chance of you developing a cancer. That is one. Two, gender or sex. Predominantly, cancer occurs to women. Breast cancer occurs to women than men. So it said that it is 99 prevalent in women and 1% or less than 1% prevalent in men. So men do have breast cancer,
nice.
but it's just rare.
Okay, so for me to chip in, so a man can have breast cancer.
Of course.
So it's not only women.
Women.
Oh, that's nice.
Yes, and then sometimes to exposure to some radiations. Not all radiations are harmless. Some are harmful. So we have radioactive gadgets like mobile phone. So when women place their mobile phone around their breast, your exposure to some machines that radiate some harmful, rays can also expose you to such a thing. Then obesity or overweight also increases the chances of developing cancer. Unhealthy eating also increases your chances to developing cancer. And then the time you start giving birth, how early or how late it is. Your obstetric history can also increase your chances depending. And then those who drink alcohol a lot and those who smoke also increases their chances of developing cancer. So these are just a few to mention.
Oh, that's interesting. Wow. So so if I'm having breast cancer, what will show? Like, what are the signs and symptoms that I will see or I'll notice within my breast or my body that will tell me that there's something wrong with me, I need to get help?
All right. So number one, there should be a change, or when you see that there is a change in the shape of the breast, and the size of the breast and the appearance of the breast, these three things, that means if you're a man or a woman, especially women, you should know the normal breast size you have, even though naturally women have one size of their breast slightly smaller than the other. It is not that obvious, but when you see an obvious change in the size of your breast or the shape, everyone has his or her own breast shape anyway, depending on your age. Some had fallen, some is pointing, and all of that. But whatever breast size or shape you have, when you see that there is a change in it, it should prompt you that you should go for assessment. So the size and the shape, and then the appearance, the skin color. You have your normal skin color, but after some time you see some spotting, changing, reddening. All these changes should be probed into.
Okay.
So you check that one out. And then when you feel that there is tension or your breast is having some tension in it, it's tensed, then you can also examine it to see whether there is a lump that is extra than the normal lump we have. And normally, your breast shouldn't have any pain in it. Even though breast cancer also is not painful, but rarely, if you feel any pain in your breast, it could be cancer or any other thing. You have to check it out. Then you shouldn't have discharges. If you see that the breast is discharging some fluid, whether it is smelling bad or not smelling bad, it is not normal. You should examine it or go for further assessment. And then lastly, you shouldn't have the nipples also change. Everyone has his own natural nipple. Some is already invented. Some is also out already. Some is flat. So when you see that there's a change in the nipples too, you should call for attention. So these are some of the few things I can mention for now.
I see. So you see, you mentioned something like it's painless. So if maybe somebody is having, maybe for the person, it's only pain that the person is supposed to, but the person is not experiencing any pain, and there's nothing that is happening around the breast. Could that even happen? Maybe the size has not increased, or maybe there's nothing showing, but the person is having breast cancer. Could it be
Yes,
possible?
they are all some abnormal signs. We are not saying they are cancers, but what we are saying is whenever you see any change
Any
in your breast
change?
at all,
Alright,
even though when you are menstruating on ovulation
sure.
day, you may have some
Yeah,
changes in your system.
sure.
Aside from that, any other thing, just go and assess it. It could be
Right.
any other thing that is not even cancer, yes.
Okay. Okay. So the ovulation one, when the breast, when there's change within the breast, that one is different.
Sure.
But aside that one, if you're not ovulating and you see any different changes in your breast, you have to
Of course.
be examined to see.
Sure.
Thank you very much for this insight. Mrs. Dorcas, please can you help us with the diagnosis?
For the diagnosis, you have to go through 3 procedures. Sometimes we need to jump depending on the signs and symptoms or the complaints that you came
Okay.
with. But we have 3 diagnostic assessments that you have to go through. The one is good history taking and physical examination. You know, as you walk into the facility to complain maybe the changes that you've seen in your breast, the health personnel or the medical officer you met should be able to take a very good history, ask you the necessary questions that he's supposed to ask, rule in, certain conditions and rule out certain conditions. Because it's not only cancer that affects the breast. We have so many conditions. You were asking about the pain.
Yeah.
We have breast engorgement, inflammations of the breast tissues. We have fibroadenomas and all those stuff. So if the medical officer is able to ask you good, questions, the answers he or she gets will help the individual to know whether you are gearing towards breast cancer or not. So that's an aspect. That's the A of the one.
Okay.
So the B is a very good physical examination. You have to do a thorough physical examination of the breast. We have 4 aspects of it, but in breast examination, we just do 2 of them. We inspect and then we palpate. So on the inspection, just as my brother said, is there any changes in the appearance of the breast? Something that the physician should see and know that this is a change. It's not a normal, thing that I'm seeing. And after that, he will touch the breast, not touching as in touching, but examining it, palpating it
Yeah.
to see whether there are lumps in it, whether that lump is fixed, whether it is movable, whether it is not. And then after that, he goes to the areola, the nipple areola area, and then squeeze the breast to see whether there are discharges. So that's an aspect of it too. So on the B or the second assessment, you have to do scan, whether ultrasound scan for 35 years and lower, and then mammography for 35 years or 45 years and above. So that one too will pick the cancer cells. So the physician, after the reports, when he sees the image, he's able to see and know that no, these are cancer cells that are developing.
Okay.
And then another aspect, that's the last one, the third assessment, is to do biopsy.
Biopsy.
When you come to the hospital, we have to take a part of the, tissues that are growing inside for the pathologist to know the tissue that is, growing, the staging of it, and know the whether it is cancerous or not. In the normal instances, whenever a tissue or a tumor is taken out of an individual, that tumor is supposed to go to the lab for the physician to know whether it is cancerous or not. So the same thing applies to the breast. Whenever a lump is taken out, it should go to the pathologist for them to stage whether it is a cancerous or not. If it's cancer, what stage is it? So nobody should stand up and then just diagnose breast cancer unless the
Okay.
person goes through these three assessments. So unless you go through it, please, you cannot sit at home and say that you have breast cancer. So you're going to for medication, herbal concoctions to heal yourself. No, you have to go through these three steps. So that's how we diagnose breast
Yeah.
cancer.
Okay. Thank you very much. So she said, not touching us in touching, but touching. This touching is for purpose.
Yeah.
For a
very
purpose. So when you were saying something like maybe based on the presenting complaint the person is giving,
Yeah.
it will help the physician or the medical officer to be diagnose the breast very well. So it means that maybe sometimes there are certain things that happens to the breast, but it's not cancer.
Yes, we have,
Other
like I said, we
conditions.
have other conditions.
Oh, okay.
We
Okay.
have fibroadenomas. Even when you are menstruating and the breast is limpy, you cannot, examine the person unless after menstruation.
Okay.
And we have inflammation of the breast. We have breast engorgements. We have so many inflammations that occur in the breast.
Interesting.
You see,
Wow.
even when somebody gives birth and the baby is not suckling well, you see there are pain in the breast.
Yeah.
The breast gets engorged.
Sure.
It's also a condition.
Oh, okay.
So unless, and we have cardinal signs. Whenever we are taking history for breast cancer, we have cardinal, just as my brother said.
Yeah.
Are your nipples, normal to you? Do you see? We have something called pure du orange, like the orange appearance of the breast. Are you seeing those kind of stuff? When you raise the hand, is the breast following? Are you having dimpling in of the breast? All these questions should be asked
Okay.
before you do your assessment as on the physical examination. So for the history taking, you are ruling in certain condition and you are ruling out certain condition.
All right.
So what the patient brings in, that will give you the guidelines to know whether you are gearing towards breast cancer or fibroadenoma or whatever. So that one will help you. So in breast cancer, you have cardinal signs, the things that you are looking for, and the answers that the patient will give to you will help you draw the line. That's no, this case, I'm dealing with breast cancer.
Wow. Wow.
And in medicine, we say that when you take an accurate history taking and physical examination, you are arriving at 80% of your diagnosis. Because, health is not magic. We are not doing magic over there. It's what you say, what the physician asks. We all draw conclusions, say, oh no, this one is this. Okay, let's go for labs and then see. So that's how we do it.
Wow. So, my viewers, I hope you've all heard what she said. So, not only breast cancer is the condition that women we experience. There are other conditions that are attached to the breast that whenever you see all these, you need to go to the nearest facilities to be checked to know what exactly is happening. It might not be breast cancer. Maybe you are even scared. It might not even be breast cancer.
Yeah.
So let's try our possible best to get to the hospital and get checked. Thank you very much. So, Mr. Ima, please, are there any treatments, or whenever somebody is experiencing or somebody is having breast cancer, are there any treatment to that? Are there any hope for the person? Can you help us with that?
Yes, your question is very important and interesting to know. Even though cancer is fought squarely and the journey is tough and it's expensive, but still there are some forms of managerial treatment. There isn't any definite, cure for it as of now, but we advocate for early detection of the disease, for early initiation of treatment. So, first of all, the first thing that comes to mind is surgical operation,
Okay.
especially at the early stages of the disease. So when it's identified early and it's small, we just think of removing it out of your breast. Sometimes we can just take it out and not cutting the entire breast out. But if it has, so much proliferated in the breast, or it has spread so much that we cannot just pick some and leave the rest, we might want to take the whole thing out for you to be free. Otherwise, it will move to other parts of the body. So surgery is one.
Okay.
We also have radiotherapy or radiotherapy. It's also a form of radiation that we expose to your breast. This time, not to increase the cancer, but to shrink and make it static and contain it,
Okay.
thereby reducing its spread or controlling it. So radiotherapy is there. We also have chemotherapy. They are forms of drugs, tablets, and all of that. When you are given, it also helps the cancer cells to shrink and reduce its migration or spread to other parts of the body. We also have hormonal therapy. You see, some hormones play role in cancer development. So when you start developing cancer, the hormones changes in the body, and then we might use other hormones to correct or balance your hormones. So hormonal therapy is part. You may also want to introduce a dietitian or nutritionist in order to help you take in what will boost your immune system so that you stay healthy. Yes. For that reason, we also have immunotherapy. Because cancer hits hard and brings your immunity down, we also have to treat you in terms of your immune system so that your immunity what becomes stabilized. So sometimes the last thing I'm adding is that because it imposes psychological stress on anybody, we might also invite the psychologist or clinical psychologist or counselor who will also take the person through some psychological management. These are all parts of the management or the treatment for it. Yeah,
Wow.
thank you.
So it's like it's a whole
Yes,
something on its own.
a combination of specialties.
So is it affordable? Is it covered by insurance? Oh,
Unfortunately, it's not affordable to the ordinary Ghanaian.
wow.
Yes, even in Ghana, the treatment is not as compared to the Western world, but it's capital intensive. That is what I would say. It's not that affordable.
So has there been any cases that have been coming to the facility? Like, is this breast cancer? Is it common or is just rare? We are just saying it.
Breast cancer is real. It's real. I was talking to one specialist. He said he has seen a 23-year-old with a breast cancer before, and myself have seen a woman whose breast has been taken off. Yes, about when I was engaging her, she said 2 years ago. So it's not something that is in the blues or something. It is with us.
So that,
It is very
wow.
real. So you should work on it and then try as much as possible to do what you are supposed to do, to detect it early so that the treatment one my brother is saying, you'll be able to start it promptly to help us in our recovery.
Okay, so Mrs. Docker, since the treatment is very, very expensive and sometimes we cannot even be able to
Oh, yeah.
afford, not covered by insurance, how are we supposed to prevent ourselves from getting breast cancer?
Okay, for the prevention, like my brother said, the causes is the opposite of the causes. So as human beings as we are, some of us are into smoking, alcoholism and all those kind of stuff. So we should do our best. If we cannot abstain, we should reduce the intake of alcohol.
Alcohol.
Mhm. And also we should stop outright. Smoke in itself doesn't help the cells in our body at all. So if you smoke, it's like it causes an impediment in the function of the cells. So please, if you are smoking, you have to stop it. As for smoking, you have to stop it outright. And also, we should try as much as possible. Whenever we finish, having our periods and those stuff, we should do our self, examination to detect the cancer, whether cancer or any other, kind of
Lungs.
growth in the, we should be able to detect. Sometimes whenever we detect, it's like we are in self-denial. We don't really accept it. No,
Yeah. No,
this
that's
then the person will be sitting down. No, please, if you detect, walk into any facility for help. And also, our women who are on contraceptives, please, we shouldn't abuse them. The estrogens and the progesterones in the oral contraceptives, they provide a very conducive atmosphere for cells proliferation, abnormal cell growth. So if you abuse them, you are at risk. And also, we should try as much as possible. Sometimes whenever someone gets married, the person will say, "Oh, me because of my shape, I don't want to give birth. I don't want to spoil my shape and all those kind of stuff."
Yeah,
When you
very
are
important.
exposed to estrogen for a very long time, you see, we are talking about age.
Yeah.
Like I said in the oral contraceptive, the estrogen provides a very, conducive atmosphere for cell growth. So when you don't cut it, in one way or the other. Cutting the estrogen is when you are pregnant for maybe 9 months, your baby suckles the breast. You see, you have a break of that woman.
Yeah.
So if you say, "Oh, me, I will not give birth," and you are just sitting there, though you are married, it means that you are being exposed to the estrogen and the progesterone for a very long time. So you have, as you say, when a chance comes for you to give birth, please do, so that you have a break of those
My
kind of,
ladies,
yeah, your ladies, we really, really have to,
give birth.
yes. And
When the
please,
chance.
if you have a family history of cancer,
Okay.
any kind of cancer at all, you should also seek for medical attention. And most of the times, it's very, good if a woman or, a young lady to take a scan, ultrasound scan of the breast,
Breast.
one way or the other, or mammography. Please, when this is the end of the year, take it as a gift for your body. Just do mammography or ultrasound of the breast to know whether your breast is in good shape. And also personal hygiene, sometimes our bras, we don't watch them, the
Yes, mention
metals,
it again.
yes,
Mention it again.
we don't watch them, it's just one, the metals beneath will be coming out, will be pushing and then putting the
Yeah,
threads to,
yeah.
adjust it.
Yeah.
We should try as much as possible to change our bras. You see, we have 7 days in a week. At least Wednesdays, you should know what you are putting on. Tuesday, you don't put on the same thing. Put that down, wear another one. So that, your breast will not be so much, familiar with one bra. You see, you have to be changing and then good diets. You have to eat well. And then, the air that we breathe through should be free from smoke. And then please, if you live at a place where people smoke, there are so many smoking around, or there's so many burning of refuse, we should try as much as possible to move, if it's possible,
Okay.
or do something about it,
Okay.
so that we'll be free from all those abnormal cells.
Wow. Today looks like I'm learning something new.
Yeah,
Please,
of
I hope
course.
you're also learning something new from this show. Mr. Emmanuel, please can you help us with some of the complications or prognosis of breast cancer?
Yes, as I mentioned earlier, through surgery, you can lose your breast.
Okay.
And your breast is part of the body, so loss of body parts is one of the consequences of, the disease, and also the fact that cancer moves or spreads to other parts of the body. Unfortunately, it can move to the lungs, it can move to the brain, it can spread out in your blood, and any form of spread is a complication of it. Lastly, I would like to add that when you develop cancer, especially in the advanced stages, it brings your whole immunity down such that it allows any other disease to take up as well. So you'll be living with the cancer and other diseases are also fighting you together. So immunocompromised, you become immunocompromised. This is also one of the complications of cancer. Yeah.
Wow. So before we come to an end, Mrs. Okas, please can you help us with the examination? How someone can examine the breast?
It's very important that we
Yeah.
do breast examination.
So
Whether you are doing it on your own or you go to the facility for a health personnel to help you, is very important. But before we go through that, if you are a woman who is menstruating, you have to do that after your menstruation, because most of the times when you are menstruating, the breast itself becomes heavier.
yeah.
So you will not, differentiate whether this is a lump or not. But we want the breast to be more lighter. So you should do it after your menstruation.
Menstruation.
And if you are already a menopausal woman, any time in the month, you can do it. So when you're doing breast examination, you can stand in front of your mirror, and then, like we said, you have two techniques for physical examination. But in this sense, you are just applying just two. So you inspect and then you palpate. So when you stand in the mirror, you just take everything off. Your bra shouldn't be on your waist or something. Everything should be off. So you look into the mirror. You know the normal things on your breast. Is there any changes?
Okay.
Is there any dimpling? Is there any, the nipple areola dimensions? See the black one around
Yeah.
the nipple. Are there changes in it? Are you seeing obvious discharge? Even though you've not touched it, do you see that an obvious discharge, whether blood or any clear fluid coming from it? So after that, you lie down, or you can still stand in the mirror, and then your hand, if you are examining the left breast, your hand should be on your neck to extend the breast. So you start palpating. You can start from the this part, and then you go. You have to sweep on the breast. You shouldn't be tapping it. If
Okay.
you tap, you miss a lump. If there's a lump in it, you miss it. So you have to, sweep it, go, come down, sweep it. And then after that, you palpate your areola, your axilla.
Axilla.
Most of the times, you see, the nerves, the tissues of the breast extends to the axilla. The armpits.
Okay.
So some lumps may start from here and then they will travel into the breast. So if you don't palpate the areola, you may miss. And then there are some lymph nodes here. You have to palpate to see whether there are like abnormal enlargement of any lymph nodes. And if there are lumps, you have to report. It's not only in the breast that we see lumps that we should report. If you see lump on your armpits, you have to report it. You see, cancer cells, whenever you palpate a lump, it means it is advancing.
Okay.
But whenever you see a lump and then you walk in, you take a photo of it and then you take it out, it means it's benign. It's nothing to write home about, or it's nothing serious. So you have to report any lump at all. Whether you are feeling pain or not, you have to. And then the next, you have to move to this part and then you palpate as you did this time. You have to do it. And please, the men too should help their partners. Married couples.
Yeah, it's very important.
Yes, you see,
Men, the men.
Yes, the breast is not, though it's on the women, but it's the men who fancy the breast a lot.
Of course, of
Yes,
course.
so please, the men should also help their wives,
Yes.
to do it,
Married,
so that
married men,
Yes.
right?
Married men.
Married men.
Married men.
I see.
to do so
I
that
see.
you can detect any defects early for proper treatment to be initiated.
Okay.
Yes, so thank you very much.
Thank you very much. Today I've really learned something. And my viewers, I know you've also learned something today. So you need to go and check. Go to the hospital, get checked. Don't be shy. you see, go and check, because the touching the doctors are going to touch is not for any other touch, but it's for a purpose.
Therapeutic touch.
Yeah, a therapeutic touch, sure. Please, do you have any final words for
Yes,
anybody?
when my co-guest was tackling the prevention, I took notice of something she said, which is very powerful. She said that for alcohol, you can reduce it, but for smoking, you should stop it. So the emphasis is cease smoking. Smoking has nothing
Yeah.
to fancy about. For smoking, cease it. But for alcohol, we advise that if you cannot stop, at least reduce it. But interesting thing is that I found this cigarette box
Yeah.
on a bare floor once ago, and I saw at the back of it, smoking causes lung cancer.
Cancer.
Sometimes smoking causes cardiovascular disease and all of that. So I was surprised that people still see this. They have the box, they pick strokes of the cigarette out of it and smoke everything. They read it as well, but they ignore it. And funny enough, women are also smoking a lot today. So please, we should all stop smoking. That is my final words. I greet everybody.
Thank you.
Okay, for me, I would say that breast cancer is real. It's really happening. People are getting it. It's not far from us. Everybody at all is at risk, whether you are a man or woman. So please, we should help each other. Whenever a relative is being diagnosed of a breast cancer, it's a collective something that we should help to come together to help the individual who is having the breast cancer. So please get checked. October is still not dead. Yes, let me put it that way. So please, even if October is over, you can still walk into any facilities to get checked.
Yeah.
So please get checked. Thank you very much.
You're
All right.
welcome. Thank you very much, my guests, for today's show. Please, as they've said, try and get checked. If you are taking in alcohol, if you are smoking, kindly stop. And also for the alcohol, I wish you stop. But let me end here. Please, but if you know anybody battling with breast cancer, there's an organization that's Dorothy at AfricaCancerFoundation.org. Dorothy at AfricaCancerFoundation.org. They are providing a free surgery for anybody battling with breast cancer. So please, if you know anybody, we put it on the screen for you. Please kindly try and contact these people to get help. Thank you very much for watching this episode with us. We know that you've learned a lot. Today, for me, I've learned a lot from this session. I know you've also learned something. Thank you for joining us and see you next time. Bye bye.